Hello, it's Nurse Kathleen. No insurance, no worries. I've got some information for you here, and I'm here to help. So here's an option. If you have this option, to me, it's one of the best options. Even when I carried health insurance, Blue Cross Blue Shield, I used this company. And hopefully there would be one in your area. They do not take insurance. They are medical, but they're also holistic. And there's a group of nurse practitioners, and then they have a holistic doctor that's also a regular medical doctor. But what I do, and I'm going to show you here, so even when I had insurance, I used them. And there's many reasons for that, mainly the holistic part of it. So what I do, I'm just going to go to fees so you can see, and they base it on your age. So there's a one-time enrollment fee, and hopefully you have something like this in your area. So you see how they base it on your age. So mine is locked in for a certain price. I don't pay, I'm between 51 and 64. I pay $75 a month. And then when I hit 65, I'll go up to the $100 a month, but my price is locked in. So this is what I have. So I pay $75 a month. So here's some of the benefits, and it actually was less for me to do this than to use my regular Blue Cross Blue Shield when I had it. Number one, you have 24/7 access to them. You can text them, you can FaceTime them, they can do Zoom chats. That $75 a month includes free visits. So whether I see them one time a month or 100 times a month, it doesn't matter. The only thing that would cost me would be labs. They do free EKGs. So when I get labs drawn, and I'm just gonna give you an example, I can get a complete metabolic panel, a thyroid panel, I can get a lipid profile, and every single hormone checked, right? Every single one. There's like 4. And it will cost me whatever it costs them, which is around $131. And then they charge $3 to get rid of the needle and, you know, anything they had to do to draw the lab. Other than that, it doesn't cost me anything. So for that $75 a month, I have free access 24/7. They do free EKGs. There's some other things that they do free, and I don't even have to go in and see them. We can do it unless I need to go in and see them. So that is a huge thing. And like it says there, wholesale labs and medication costs, and they pass them right on to you. Another thing they'll do on a couple of medications that I take, they actually have a discount with pharmacies, and they actually send that to me to go show the pharmacist, but I actually use GoodRx, and that works well for me. But that's one option. That's what I do, and that's what works best for me. I'm going to give you other options as well. So here's another option I think a lot of people may or may not know about, but Amazon, if you can see, under medical care here, they have One Medical, they have pharmacy, and they also have clinics. I have gotten medications through their pharmacy. It is a lot less money. Let's say Allegra, for example, instead of paying a certain price at pharmacy, I can actually get 3 months worth for the price that I get 1 month's worth at a pharmacy. But I want to show this to you because it's really cool. So on the pharmacy, it's really easy to get set up with. That you put your doctor's name in there, and then they will, if you want to transfer your medications over, they deliver them. It's very, very simple, and it'll save you some money. So this is Prime One Medical. Care Team On Call, $9 a month with Prime. Now, if you don't have Prime, can you still have it? Yes, you can. Sorry, it's on a computer here, so you're going to have to see that. So get Care On Call every day. Concerns for only $9 a month. So it's $9 a month for more like a telehealth type thing. You can see the 24/7 on-demand virtual care. They do have offices in many cities. It's a little bit more for that. They do accept insurance. And you can pay monthly or you can pay annually, as you can see there. So some of the benefits, let's go here. It's a touch screen, so it makes it really easy. So you can see some of the benefits there. 24/7, on-demand care, video chat or treat me now, book appointments online, receive messages. So all of that, they can do prescriptions, refills, and renewals. So that works really well. I mean, it's really a great option to have, and a lot of people, they're just not aware of it. See how they're trying to book appointment online right now? So basically it's telehealth unless you decide to go in somewhere. So it's under medical care right here, right up here. And I'll show you the clinic. This would be an option that I would consider if I didn't have the other. And you can see their customer satisfaction is 4.9. And then they have all these related conditions, not related, all these symptoms and conditions and information about it. I think it's a great program. It starts, let's just click on one here. I'm gonna click on this one. Let's click on COVID-19, since that's been real popular. So for that virtual visit is $35, and they can actually give you medications, and they'll be at your local pharmacy. They can call them in. This is if someone needs to be seen like online really quickly. No appointment or insurance needed, and you have a positive COVID test. Let me go back here. So you have acid reflux. So look what happens here. So it asks you to choose your state. So let's choose a state. Let's pick Florida. So see, in Florida, you can message for $40. And so you've got that $9 virtual, but this is if you need like a get it now appointment. So on the acid reflux, you see in Florida, where I live, you can message and it's about $40, right? And the response time, they're telling you what the response time is. They even tell you medications that they order for that type of thing. So, you know, if you can get it over the counter, and this is through an online clinic. So Amazon has all of that, but there are many, many options. There's a lot of information in here. And like I said, it's a really good option. Here we go. So you've got the One Medical for $9 a month. You've got the pharmacy, and then you've also got the clinic. And like I said before, I've used the pharmacies. They even take insurance. See, they got an RX Pass here now for $5 a month with Prime. There's 50 plus medications. It's just, I think it's a great alternative for people that don't have insurance, or if you have insurance and you want to have an alternative and it might save you some money. I just think it's a great option. I really do. I spoke about this on a prior video. The website is aapsonline.org. And this is the Association of American Physicians and Surgeons, and they've been around since 1943. They have taken the Hippocratic Oath that we do as healthcare professionals. And I want to show you something. There's a wealth of information here, but right here where it says find a direct payment, cash friendly practice. So when you click on that, it actually takes you to physicians, right? And then if you're a physician, add your practice here. That would be great. And then more resources down here. But look at this. So these are a list of physicians, and you can, change it by state here. See where it says state? So you can change it by clicking these different things and going from, backwards to forwards, A to Z, Z to A. You can look at different specialties that they have. And then any notes or anything over here about them. And right now they have 1,571 providers. So you just have to look and see if there's any in your area, but it's a great resource. And these people take cash. And normally I have found in my experience, when they take cash, it is a lot less than what they bill the insurance company. The other thing I saw on here, I don't know if you remember, but telemedicine was huge in 2020. People were not able to go to the doctors, or, people had to stay at home based on their symptoms. And you can see up here their protocols. I'm going to do a video on that. So there's a list of independent practices, telemedicine, all these are telemedicine, right? But I happened to look at this one in particular, myfreedoctor.com. Check this out. This is cool. Decline cookies, frequently asked questions. Okay, so it's going to tell you, it says, we are a free donation-supported medical consultation service that connects patients directly with doctors. How do you get care? So this is what they do. They accept a certain amount of patients every day. So it's free. Okay, free. So obviously you want to get in early in the day and come in and sign in and do what you needed to do. And then you just follow the instructions here on the wait time, when you get a response, and then how do you get your prescriptions, which they send, to a pharmacy. We do not accept insurance, will not offer a prior authorization or pre-authorization for medications. So it looks like they use ERX, which is how most do it. Everything's done electronically now, but this is free. I mean, free. So you kind of have to look around. I'm just trying to show you some things that I have found looking on the internet, to help people. And as you can see, there's plenty of telemedicine on here. Plenty of it. So it's just, this website is a wealth of information. And again, you can see here more resources. And I looked through those, and it's pretty extensive. There's a lot you can learn and find out from this website. And I'm going to do a video on that and another website to give you more information about some other things. But remember, telehealth, it has become huge. And unless you really actually need to see someone, they can't take your blood pressure, obviously, and, draw labs or anything like that. But if that's not needed, it's a great way to go. I definitely believe in it. And when I was my last 5 years, I was at the VA and I worked community care. They actually did a lot of telehealth, especially from, 2020 forward. Here's another great resource. People know about GoodRx through their drug savings program. And a lot of times you can get medications less than you can get through your insurance company. I know my family's used it. I know a lot of families have used it. But they also have this. So this is care for appointments from licensed healthcare providers. And it's a membership. So as you see here, online visits start at $19 with a gold membership, right? And so there's no insurance required. They do a lot of services. Let's see, click here. Give me just a second. I'm having to just use the computer. So they talk about, general care and testing. And I mean, there's just so much information here, right? And you can look through the website and see that. Let's go back one, and I want to show you something. So they spoke about what is a GoodRx Gold membership. So if you click on that, it tells you that you receive 90% off your prescription medication. Benefits include, treatment with a healthcare provider online from anywhere for less than the cost of a copay. And with your membership, the online provider visits are just $19. So you pay that $49 for the gold membership. Now, they do say some memberships start at $9.99 a month, less than $10 for individual members. So there's a lot of savings, and the visits are $19. Of course, it doesn't exclude labs. They can order labs, and you can go to LabQuest. It could be a Walgreens or something to get your labs drawn. So that membership is a great alternative to have. And even though it says the gold membership is $49.99, you can see that memberships start at less than $10 a month for individuals. And they do offer a lot. And you can see here, and it tells you how to get started and what they can help with. So I didn't know GoodRx had this, and some of you may know that, but I did not know that. And so you pick up same day prescriptions at your pharmacy of your choice or have it delivered to your home. They got a little video there, and it tells you how it works and how much it costs. Well, let's just look at how much does it cost. Boop. I'll click on it this way. So visits are $19 with a gold membership. If you don't have a gold membership, they start at $49. You don't need insurance. You'll always know the price before your visit. So that's really good to know. So again, I think it's just another good alternative to have for those who don't have insurance or choose not to have it for whatever reason. And I'm just trying to give you alternatives to look at. And of course, you can do your own research, just trying to help some people out there. And then finally, I started doing some research. Healthline is very well known. And I was looking at research there. They do have a lot of information. And you can see at-home testing. You can look that up. You can get at-home testing pretty much anywhere and have it delivered. But you have to have someone to be able to review the results. And I would think via telemedicine, they would be able to do that at some of the other alternatives that I have given you before. The only thing I found with this is that it's not as inexpensive as it says. Some people say that this teledoc is free. It is not free. And they look at the companies, evaluate it based on certain criteria. But I was looking at some of these prices, and they're not all that great, right? So they're saying that's one of the better companies. Let me just click it with my finger. It's easier. And what they offer, now they have a $99 annual fee, right? But I'd have to call them to find out, okay, what exactly is included in that. Here's a budget-friendly one. They do provide prescriptions. That's the other thing you have to look and see. Do they write prescriptions or not? They do. They do. They do. There were some that weren't when I was looking through here. Let me scroll down a little bit more. Well, okay, so they're not going to show up while I'm trying to show this to you. So this teledoc, let's see what it says. If you have insurance, general medical visit can be as low as $0. That's if you have insurance. And if you don't, it's $75 for a visit. That, I'm paying that for a whole month, and I have unlimited access 24/7, free EKGs, labs at their cost. And those labs would have cost me about almost $1,000, and I only paid $131 plus the $3, hazardous waste fee. But even on these, you really have to read the fine print because it may not be what you think it is. Here's a membership, $15 a month, but they want to charge you $45 for every video appointment that you have. You get free texting with your doctor and follow-up. If you get them on nights, weekends, and holidays, $59 a visit. So to me, in my experience, I don't think that some of these are all that great, just to be honest with you. the first one, which is what I do, and if you can find somebody in your area that does this, they don't accept insurance, and the fees are, you know, they're excellent. And the amount of care that you get for those fees and even the free services. I don't pay for a visit. Like I said, I can see them once or I can see them 100 times a month. It doesn't matter. And I can talk to them and text 24/7, weekends, holidays, whatever. I do like the Amazon Health pretty well. I really did like that. Because they do have the One Medical, they have the clinic, they have the pharmacy, and it's a fair price. And then I would have to say the next best one, in my opinion, as a nurse, looking at costs, looking at what you get, looking at the benefits, you know, are there any extra fees and all of that, would be the GoodRx. That's what I have seemed to find in the research I've just done recently. I'm not going to say it's not going to change, but there's just so many options out there for people that don't have insurance. I went on the government website. I think today was the last day that you could do that. Maybe it was yesterday, just to see what the cost of insurance would be for me. I think it was around $600 a month. I'm like, are they crazy? It's not that I can't pay it. It's that I won't pay it. Are they out of their minds? So this is a company I use. Like I said, if you could find something like this in where you live, if not some of these others, like I said, Amazon, I think GoodRx has a good program. And then you can go to aapsonline.org and look, there's different sources there. These telehealth, that myfreedoctor.com, they do free care. I mean, it is 100% free, but they only do a certain amount of patients a day. So you want to get in, you know, early. So I'm hoping this will help people. Sorry about the clicking back and forth. First time I've done a video like this before, but I wanted to show this to you and give you some options because, you know, there are viruses and bacteria and funguses and a lot of things going on out there, and we do need to take care of ourselves. I do believe in holistic means and prevention primary. That's primary to me. All of this is secondary. But here's just some information for everyone. I hope that it helps you, at least puts you on a path, because I don't want you not to get care or information or help when you need it. And so it's really the reason I did this video. So everyone have a great day, and I look forward to seeing you on the next video.